Hello and welcome back to Mirror Interpretation Tudorova. Welcome back to my YouTube channel. My name is Ioana and I am an interpreter and a polyglot creating videos for medical terminology, getting ready for NBCMI, bilingual test or any bilingual test. I'm just repassing those terminology with you. Today's video will be a blood transfusion consent form, the most common terminologies that I think you should know, I think we should know in order to be ready to sight translate those forms or interpret in encounters where you need to talk or interpret about the blood transfusion consent form. Before I start, you can become a member clicking on subscribe button for $7.99. Once a month, I'm going to address your questions. I will create a video especially for you where you are going to have your questions answered once a month on a video or live. You can see videos related to my experience as a medical interpreter, where I provide services for, how I sell my businesses, how I do, I want to say marketplace myself, how I seek for clients and so on. And then you're going to see a medical vocabulary grill videos once a week, how I keep my brain in shape in order to interpret in 5 languages. Said that, if you're Spanish-English medical interpreter, you can click on the link below on my platform on Thinkific, where you can find a training in 2 languages, Spanish-English, cardiovascular system, soon to come the rest of the body system in 2 languages, where you can find both systems, the systems in English and in Spanish, download vocabulary in both languages, and pass a test and get certification. Said that, thank you for being here, and let's start to our blood transfusion consent form, and let's start informed consent form. Informed consent form. The purpose of this document, the purpose of the document, risks and benefits and alternatives. Risks, benefits, and alternatives. Blood transfusion, blood transfusion. Components of blood, components of blood, including but not limited to, including but not limited to, red blood cells, red blood cells, plasma, plasma, platelets, platelets, autologous, autologous, which mean collected from the patient's cells or parts, and allogenic, allogenic, it means from other person, allogenic. Supplement, supplement. Diagnosis, conditions, and indications. Diagnosis, conditions, indication. Transfusion of a blood or blood products. Transfusion of a blood or blood products. Bloodstream, bloodstream. Transfusions are given by vein, vein or vein in the arm. Sterile disposable needle, sterile disposable needle. Specialized products made by blood, specialized products made by blood. Potential benefits. Potential benefits. Correct low levels of blood components. Correct low levels of blood components. Result in death. Result in death. Risks or side effect of treatment. Risks or side effect. Irritation or infection. Irritation or infection. Needle, where the needle is placed. Needle. Needle. Temporary reaction. Temporary reaction as fever, chills, or skin rashes. Fever, chills, or skin rashes. More serious complications. More serious complications. Allergic reaction. Allergic reaction. Heart failure. Heart failure due to fluid overload. Fluid overload. Pulmonary edema. Pulmonary edema, which means fluid leaking into the lungs. Shock or death. Shock or death. Small risk of transmission of disease. Small risk of transmissions of disease. Hepatitis B, 1 in 1 million. Hepatitis B. Hepatitis C, as Charlie. HIV or AIDS. HIV or AIDS. Small risk of bacterial infection. Small risk of bacterial infection. Donated by volunteer or donor. Donated by volunteer or donor. Screened. Health history. Health history. Blood tests. The safest blood supply. Safest blood supply. Auto donation. Auto donation. Medications used to reduce the risk of blood problems. Decisions. Life-threatening consequences. Life-threatening consequences. Your signature below indicates. Your signature below indicates. Discuss the risk and benefits. You have discussed the risk and benefits. Therapies, alternative therapy or alternative cure. You consent to these blood transfusions. You consent to this blood transfusion. Your consent is not limited to autologous or directed units. Is not limited to autologous or directed units. Advantage, disadvantage, risks, and benefits of autologous blood. So autologous blood, it means that they extract the blood from you and then conserve it, and then if you need it, they put it back. So as you know, if you have donated blood, small amounts are healthy to be extracted because your body will naturally produce more and regulate the level of the blood necessity in your body. So autologous, it means they took the blood out from you and then conserve it, and after the procedure or during, if you need it, they put it back. But this also includes some risk. So advantage, disadvantage, risks, and benefit from autologous blood, which means using your own blood or the blood from donors. We have a witness signature, legal representative, or patient signature. That was our informed consent for blood transfusion vocabulary. If you find this video useful, you can support me by pressing like. If you really like it, you can donate. Any amount would be useful to support me to get better technology, to make better videos with a better sound. And if you want to be a member, you can subscribe for $7.99. And if you're looking for bilingual training, you can click on Thinkific and purchase for $47 the medical terminology training in 2 languages. Said that, thank you guys for being here and have a good day. Bye-bye.